हेलो गुड मॉर्निंग, मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे कार्डियोलॉजी सेक्शन के सम इम्पॉर्टेंट MCQ। लेट्स डिस्कस। A 38-year-old male present with chest pain and shortness of breath for 4 months. He experiences dizziness and fainting episode on exertion. His family history is remarkable for the sudden cardiac death of his brother. On examination, a systolic murmur is heard at the left sternal border that increases with valvular maneuver and decreases with squatting. Which of the following pathological findings would be present in this patient heart? Here the combination of the chest pain, shortness of breath, dizziness, and a fainting episode along with systolic murmur that increases with the valvular maneuver and decreases with squatting diagnostic of the hypertrophic cardiomyopathy SCM. In the SCM examination, if you do, the heart would reveal a disorganized arrangement of cardiac fibers, giving a characteristic of helter-skelter appearance. Here the answer. This abnormal arrangement of muscle fiber is also called myocardial disarray. If you look the orphidae nuclei, the term is associated by the papillary thyroid carcinoma. Ninja star nucleus is seen in irregular shape of the cardiac myocyte nuclei. In the prasonoma body series such as the Aryan serous carcinoma. Next question. A 45-year-old male patient present to the emergency department with bilateral pedal edema, discomfort in the right upper quadrant of the abdomen, and orthopnea. Chest auscultation reveals bilateral crepitation, the loud sound S1 sound and a pansystolic murmur point of maxillary impulses, hypokinetic and diffuse. What is the most likely diagnosis? Cardiomyopathy, acute cor pulmonale, alcoholic hepatitis, and pulmonary artery hypertension. Here the patient seen in the cardiomyopathy because the patient have findings of biventricular failures that would be seen in the cardiomyopathy. The answer. If acute core pulmonary is seen in the massive pulmonary embolism. In alcoholic hepatitis does not present in the heart failure, and pulmonary artery hypertension it will not have lung crepitation feature of left ventricular failure. Next question. A 15-year-old boy is brought to the emergency department in the early morning hours by his father, who reports that his son was having agonal respiration. His blood pressure is 80/50 mmHg with no palpable pulse. There is a family history of sudden death in a sibling. Workup shows a mutation in the SCN5A gene. Which of the following ECG pattern can be seen? I already also told the SCN5 gene in my previous video. The SCN5 gene, which of the following ECG pattern can be seen is the ST elevation is the co-pattern. Co-pattern where is seen? Co-pattern is seen in the Brugada syndrome. Brugada syndrome is a cardiac canalopathy caused by the mutation of the SCN5A gene, which leads to a defective sodium channel function. And what is the clinical presentation of the patient? Include the syncopal attack, family history of sudden death, episode of palpitation, and the dizziness. Here the show the family history, sudden death of the sibling, the Brugada syndrome. Next question. A 20-year-old female present with palpitation and exercise intolerance. She reports recurrent syncopal episodes since her teenage years. On examination, she has sparse, coarse, and frizzy hair and thickened skin on the palms and soles. Her sister died at the age of 25. An echocardiogram reveals right ventricular abnormalities, including fatty infiltration and a thinning of the myocardium. Which of the following genetic mutation is most likely to be associated? Here the clinical side highly suggestive the Knox syndrome. In the Knox syndrome, the gene mutation is plakoglobin gene mutation. Knox syndrome is an autosomal recessive disorder caused by the mutation of the plakoglobin gene mutation. Plakoglobin is a protein involved in the maintaining the integrity of the desmosomes where at the cell-to-cell junction of the heart. Knox syndrome. What is the Knox syndrome? Characteristics of combination of arrhythmogenic right ventricular cardiomyopathy and woolly hair and palmoplantar keratoderma. Is the answer. नेक्स्ट क्वेश्चन, 45F अगर हम इसका की फीचर का बात करेंगे तो इन अ पेशेंट प्रेजेंटेशन इंक्लूड पैल्पिटेशन, एक्सरसाइज इंटॉलरेंस, रिकरेंस सिंकोप एंड a family history of sudden cardiac death. Additionally, the presence of woolly hair is means woolly hair is sparse, coarse, and frizzy hair, and a palmoplantar keratoderm and thickened skin on the palms and soles further repose the diagnosis. Echocardiography shows fatty infiltration and thinning of the myocardium, particularly in the right ventricle. If the genetic test of plaque gene mutation adds diagnosis. Treatment is aimed at managing what managing arrhythmias, of course, and cardiac symptoms. Regular cardiac monitoring and follow up. Next question. A 45-year-old male with a hypertrophic cardiomyopathy present with increased exertional dyspnea and chest pain. The patient's symptoms worsen despite receiving nitroglycerin at the hospital. There is a subsequent drop in blood pressure and is the drug is stopped for the evolution. Further evolution confirms dynamic left ventricular outflow tract obstruction worsened by nitroglycerin, which drug is not contraindicated in such patient. Here the and not contraindicated in such patient, digoxin, furosemide, amlodipine, and verapamil. Here the left ventricular outflow tract obstruction in hypertrophic obstructive cardiomyopathy in this patient was with the administration of nitroglycerin. The best answer is the verapamil. Propanol is a drug of choice in managing patients with SCM. Verapamil is also a calcium channel blocker that can be used as the alternative to propanolol, particularly in patients who cannot tolerate beta blocker due to the condition like asthma or COPD. Okay, thank you and keep revising.